public gathering restrictions imposed 1 month ago. Now, the current positivity rate is double the World Health Organization recommended threshold of below 5% for reopening of the economy. Now, latest data shows that the burden of the disease is gradually shifting away from beyond the 5 counties under lockdown, which in March accounted for more than 70% of the country's caseload. Kimani Gituku is taking a look at the COVID situation in Murang'a.
Well, since Kenya started experiencing the third wave of COVID-19, the government has put measures to ensure they help curb the spread of COVID-19 in the country, among them being the locking down of the 5 counties. We have witnessed other counties, out of the 5 locked counties, the COVID cases have been rising. However, in other counties, the cases have been dropping. We are joined by Murang'a CEC, Joseph Mbai, to give us an update of the situation in Murang'a County. Welcome to KTN News, Bwana Waziri. Give us an update of Murang'a County.
Thank you very much. My name is Joseph Mbai. I'm the CEC in charge of health in Murang'a County. Since COVID came, Murang'a, we have registered 1,195 cases with about 32 deaths that have happened through our hospitals. And currently we have 11 patients who are in hospital and 17 that are home-based. And we have noted that COVID-19 cases are reducing right now, although the last 1 month or so they were very high and we had very many sick patients coming to the hospital. But I thank God that most of them have gotten well. We've lost some, but majority of them have gotten well and gone back to their daily activities. I want to say that the issue of oxygen has become a challenge in this country, but for us in Murang'a County, we've also procured an oxygen plant that is coming to be installed in the next 2 weeks so that we can mitigate the issue of oxygen in our hospitals. We have a 32-bed ICU and it has piped oxygen. So once the machine comes, it will directly supplement that oxygen, and then we shall use the old one plus the cylinders to deal with other wards that may need oxygen. Thank you.
Maybe what are you doing different with the residents of Murang'a County, because other counties are rising number of cases?
In Murang'a County, since COVID came, using the committee that has been set by our governor, we've done a lot of fumigation in the markets. We've done a lot of quarantines. We have done a lot of contact tracing, and we always make sure that the contacts are tested. The only challenge we have had before is because the testing was being done at Kemri before the rapid tests came. But right now, we have the rapid tests and we are able to test patients immediately, and within 10 or 15 minutes, we are able to determine whether a patient is COVID positive or not. But before then, we used to have a very serious challenge because results used to take 3 weeks, even sometimes 4 weeks. And I remember last week but one, the Minister of Health, Senator Mutahi Kagwe, had indicated that in Murang'a we have so many cases. And this is because the results that he was given were results for a whole 3 weeks. And the numbers were 116. And when such results are read in one day, someone is bound to think that if we have 116 cases in one day, then those people have a lot of COVID. But those results were actually for 3 weeks. It's good to clarify that, and that is the truth. As COVID is concerned right now, bearing in mind that today I have only 11 patients, then I can only say that compared to last 3 weeks, then we are doing better day by day.
What about the vaccination process? How far is it?
The vaccination process has gone very well in Murang'a County because we have vaccinated more than 22,000 people, and we got our last batch of vaccines, which is ending now. So maybe by the time we finish, we shall have vaccinated like 25,000 people in Murang'a County. And the majority of our health workers have been vaccinated. We have vaccinated teachers. We have vaccinated the elderly, 58 years and above. And for us in Murang'a, the uptake of the vaccine was excellent. Yeah.
Thank you very much, Waziri. Well, you have it from the CEC Health, Murang'a County, Joseph Mbai, calling upon residents to continue adhering to the COVID-19 protocols. Remember, with the vaccination going on, we have witnessed even the COG calling upon Kenyans not to take it lower, to continue being very strict with the COVID-19 protocols placed by the government to ensure that the COVID-19 cases are not rising in the country.
Thank you so much. My colleague right there in Murang'a getting the situation of COVID-19 at the county level. But then miles away, let's shift our focus to India.